physiological regulated medicine that is part of low-dose medicine. And really I can tell you that we are getting into a new paradigm of medicine all around the world. We speak in the United States, in Russia, in Ukraine, in everywhere, Czech Republic, Colombia, in South America, we have a lot of success. And it's a new paradigm, it's fascinating, and it's also very logical. So I think that after the seminar of today, you will be in the position to apply low-dose medicine, this new pharmacology, in your daily practice. As always, this is my personal speaking style. Please stop me in every moment. If you need to go deeper in a concept, or if you want to share your experience, if already are using these medications. So I hope to make this seminar more than a seminar, an happening. Okay, it's perfect because the number of people is right to manage in a very friendly way the seminar. Behind our scientific department, you can see there is a very important university, that is the University of Milan, that after performing some preclinical studies on isolated cells and animals, they realized that something was changing under the sun of pharmacology, and they wanted to establish, this is in Italian, an interdepartmental center for research and study of biological effects, and you can see these words, nano concentrations. You will see that the soul of our pharmacology is to use biological molecules in a very low dose that we call nano concentration. We will see which are exactly these nano concentration. That's very important because all over the world, really, all the academic people, the academic environment is realizing that finally something is new under the sun of pharmacology. And these are just some of the post-grade courses held by some Italian universities about low-dose medicine. This is the biggest university in Italy, La Sapienza in Rome, that established a master on low-dose medicine in rehabilitative medicine. University of Siena, low-dose medicine in rheumatology. I love especially this postgrad course, low-dose medicine in pediatrics. You can imagine how important can be the use of low-dose medications. That means no side effects in young people. Low-dose medicine again in pediatrics, another very important university in Piemonte, and 2 second-level master in general, in internal medicine, Verona, and once again another university in Rome. So the most beautiful thing could happen to us is that low-dose medicine is not more something of Guna pharmaceutical company, but is something of all the scientific environment.
Excuse me, are these master's degrees, are they taught in Italian completely? Or?
Completely,
yeah.
yes.
Okay, so we need to be fluent in Italian.
Yeah, exactly. But it was impossible to think in Italy just 5 years ago that some universities would have been establishing this type of postgrad course. Now it's possible. So why not in Ireland in 3 years, 5 years, 10 years, I don't know. But now this is the path. So it's something I like to share everywhere in the world, to tell you, please look that even though this is the second seminar in Ireland, we are very, very forward. So you can be part of this project.
What kind of students are going? Are they doctors or
medical doctors? Yeah.
All of them.
Yeah. In Italy, it exists only the figure of medical doctors.
Okay.
So they are for medical doctors. Yeah. And these are some of the publications about low-dose medicine, and for some of them, today I will show you the results. Another very important thing, beside the teaching in the academic environment, in medicine you know very well, you only exist if you publish, and if you publish on indexed high impact factor magazines. Some of them will be topic of the second part of the seminar. But just to show you some this is the first publication, 2009, Pulmonary Pharmacology and Therapeutics. For some of you who are involved in allergology, is one of the most important magazines in the world for allergic asthma. And we publish the results of the use of two interleukins, interleukin 12 and gamma interferon, it is not an interleukin but generally a cytokine, in the control of allergic asthma. Journal of Cancer Therapy, use of interleukin 12 in non-small lung carcinoma. Very interesting, and I will show you why it's interesting by a biological point of view. Gastroenterology Research, use of anti-interleukin 1 and interleukin 10, I will speak a lot about inflammation today, in IBDs, exactly in Crohn's disease. We discovered that the association of anti-interleukin 1 low dose plus interleukin 10, together they work such as an anti-TNF alpha. Infliximab, okay? Just to have an idea. With a big difference that when you use a monoclonal antibody, anti-TNF alpha, such as infliximab, you have, no question, great results in controlling pain, but you have also severe side effects, for instance, and higher incidence of pneumonia. International Immunopharmacology, effect of gamma interferon in increasing NK cells in early stage colorectal carcinoma patients. Journal of Biological Regulators, effect of some cytokines in psoriasis vulgaris and other cytokines in vitiligo. In the last 3 years of my life, I've been very involved in vitiligo with the World Vitiligo Association. I've been speaking in India several times. In India, vitiligo has a prevalence of 8%. In our countries, it's around 0.3, 0.5%. So it's really a disaster in India. And I will show you the results are very interesting. Minerva Ophthalmologica, this is an Italian magazine, but index magazine, about retinal atrophy. And many publications. Our effort in research is really huge, but we think that to be accepted by the academic environment, this is the way we have to follow. And why not? Maybe in some years also in Ireland we'll be in the position to perform some clinical trials. I stop these slides, otherwise I will stay 1 hour showing you all the